All testing, so. And then I'm gonna back over here in a little bit. You talk a little bit about PawPrint versus some of the other genetics companies, and then we'll do its other things. So, what question can I answer for who? Anything's game. If I don't know the answer, I'll make it up or I'll ask him. It doesn't have to be a genetic question. Oh, okay.
How come we don't harvest eggs on dogs, but we do on cows and horses?
They haven't perfected it yet. There are places that have tried. Part of the problem isn't harvesting, it's coordinating the heat cycle of a bitch with another bitch so that you have a surrogate. So it's not like cattle that you can go in and synchronize heat cycles on cows. You walk into that barn, you give an injection to every cow in the barn, and they all come in the same bitch. We don't have that, as you know, dogs communicate rather on their own. And even when we try to initiate heat cycles, we're not always consistent. There are some very limited places that have eggs and embryos frozen.
That's what I'm wondering.
Yeah, I have one client that has 4 embryos frozen at Cornell. It's the second client dog that they've accepted there, so it's not mainstream yet. We're not good at synchronizing them to ovulate or good at harvesting the eggs. On cattle, they flush the uterus. Yeah. And they'll harvest the eggs just by flushing the uterus, and dogs, it's done at a spay. So there's just a lot of logistical problems with it. So he waited for his dog to 11. When she was here, we timed her. He waited in the parking lot with his camper for a week. The day she ovulated, he headed to Cornell. They spayed her. They harvested 7 eggs. They fertilized them. They had 4 frozen embryos, and now we're trying to get him to the point that he has a bitch that's fertile, because everything he's done so far, he's hit a wall, hit a wall, hit a wall. And hasn't gotten a bitch that's ready to be a surrogate. Litter first, and then they have to be implanted. So there's a lot to that. Cloning is the same. 1 in 3 cows that they attempt to clone turns into a live calf. We're nowhere near that technology in dogs. And then semen sexing is another really interesting topic. Y'all know about semen sexing? Yeah. That in cattle, they can now produce 96% peppers if they sex the semen. So we do that. They started it in Texas, and the local facility here is 20 minutes from here. It's like 15. So they sex bovine semen. So they use a laser to sort the boys from the girls, and then most of it goes as waste because they can't really tell. And because bulls have billions and billions and billions of sperm, if they waste some, it's not too big a deal. In dogs, we don't have that. Plus, that particular facility is EU, European Union only. So other species can't be brought into the facility, other semen can't be brought in. So there's lots of interesting little things that we could be doing with cloning and semen sexing and fertilizing eggs and saving them, but we're not technologically there yet. There are lots of people working on it. One of my clients works on it at the University down in Milwaukee at UW. So there's things going on. It just hasn't come to a general practice setting yet. So maybe in our lifetime, but you can't just take an egg and throw it in the nitrogen. I mean, an ovary and throw it in the nitrogen and hope that you get eggs someday.
Yeah, I mean, I've actually done cows. There's been a number of years that we super ovulated high producing cow and bring embryos, some frozen, some stuck in cows,
right?
Others.
And Lisa and Jeff that work for us, and Carla was the older sister. They're the 3 of the 6 kids in the Hayes family. They have a huge number of UT calves that are out there, the embryo transfer calves, and they've been doing it for decades, but we're just not that sophisticated. And flushing a uterus in a dog and then trying to collect the egg, it's a lot. It's a lot. It's not a big old animal. You put your arm in and flush, and it's a whole different set of. Yeah. It's a matter of scale more than I think probably anything.
Just wondering, I'm like, I want to do this with Emma.
I know. And your dog is your pet. The house, most of the bulls belong to a bull semen company, not an individual, so they're not sleeping in the bed with you. I mean, there's a lot of logistical things here. Other questions?
Bob wanted me to ask this question, and that is, so we've frozen every single one of our neighbors. And we've been notoriously bad luck ever getting anything like that.
So
is it the bitch? Is it timing?
And it's all those things. Sometimes it's semen quality, and it may look good when it thaws out, but with using the nuclear counter, you can assess viability of the sperm because it's a process harder. It would actually have viability. There are DNA tests to do, as CSA is going to stuff it for them. For for semen to see if there's fragmented DNA in it, so you know, that's some of those things going on. Finding is essential. We do a lot of TCIs, but there are bitches who get pregnant with surgical pregnancies that don't get pregnant. The TCIs,
I think that had surgery the frozen salmon, yeah. A surgical military, so children, two puppies.
Yeah. Sometimes it's nutrition, we look a lot, I look a lot at nutrition. People come in and say, I'm having a fertility issue, I ask you 3 questions, what do you feed? What else do you feed? Because nobody feeds one thing. You all feel like you put something else in and then you put supplements in as well, so what supplements are they on? We see a lot of trouble with a lot of the diets.
What in the nutrition has you concerned?
Well, just fertility in general, we don't see great fertility unless we're feeding Purina or Royal Canin, I assume straight from. I'm not gonna call out any negatives to any of the diets that are out there, but I will tell you that I consistently see some diets that are.
Are you looking for too much phytoestrogen or?
No, probably they're not, like the HT42D is a European pregnancy diet, and it is a soy-based diet, so a lot of people are concerned about that for phytoestrogens, but they accumulate those, so that there's not phytoestrogens in that product. But it's a micronutrient issue. If you look at the handout that I have and provide to you, I don't have it up here at the table, on the micronutrients, there's amino acids and some minerals and vitamins that are present in micronutrients. And when you look at a bag of drugs, you look at a bag of any brand, I'm not gonna name any, you look at it, that, compare it to Royal Canin or Purina, the macronutrients are fat, carbohydrates, and proteins. Those are easy to compare because they're big numbers, you can see them. Anything you get below salt on the label, on the ingredient list, remember they're always by weight, is anything below salt are the micronutrients, so those are the vitamins, the minerals, the amino acids, some of those things. And I can tell you that when you look at some of those diets compared to the Royal Canin, Purina, Royal Canin HT42D or Purina Sport 3020, we see probably a deficit in some of those micronutrients that are contributing to fertility issues, both on the male and the female side. So even though HT42D is labeled as a pregnancy diet, it's also anti-inflammatory, and there are some male dogs that do better with their semen quality on that diet. So yes, it's not just for pregnant dogs. It promotes.
Do you have that in your handout?
The male part, no, but the female part, it lists all the stages of her prior to her coming into heat, during the heat cycle, the ovulation, the embryo development, the placental development, and the embryo development beyond being the living cells. It lays out all the amino acids, all the micronutrients in that handout that you can then look at. But if you try to call one of the other companies and say, well, tell me how much arginine you have in your food, you're not going to get an answer. So that's the problem. I can just tell you what we've had success with. So those are my 3 questions. What do you feed? What else do you feed? Raw meat diets are notoriously a problem. So for the people who feel like they have to feed raw meat, I'm flat out not interested in helping much with that. Fran Smith used to fire clients that run raw meat diets. Just flat out, she would fire them. We see problems with nutrition, and we see problems with bacteria and parasite disease. So there's just a lot of things that go on with raw meat diets, and I'm not a big fan of. So if you feel you must feed raw meat, please don't feed it during heat cycles and pregnancy. Please don't feed it to your stud dogs if you're having fertility issues. So get them onto one of those foods. I've had multiple clients. So I was telling the story yesterday. I speak to the Amish and then I use a lot, and I have a client named Sam who lives down in Missouri. And he got in the van this spring, and came up to Ohio. So he lived there with his wife and his kids in an 18 passenger white van, and they drove, as an Amish family does, in the white van to the meeting in Ohio. And he said, Dr. Greer, I'm having problems with my fertility. He'd already kind of been a little bit of a burpee. And so I said, well, what's going on? And he said, I was feeding a brand of food. And he said, some guy knocked on my door and said, I would do better if I said this other brand, which again, I won't name because I'm not recording anything for posterity. And I said, okay, when you get home, I want you to go to the female and either buy Purina Sport 3020 or go to Royal Canin, and because he's Amish, she has to keep one. Because going on the website and ordering food from Royal Canin was one of his options.
Unless it's hard to do.
Unless it's under the phone. He does have a flip phone, but because he's sending pictures on his phone. But he went to the store, went to the female, bought the food, called Marilyn at Revival the following month and said, I had 22 bitches not in heat, 11 of them are in heat and black. He called her a month later and said, those 11 bitches are pregnant, the other 11 are in heat. He had 22 litters,
Oh, God.
all within about 6 weeks
Wow.
of each other, of 10 puppies and more.
Oh, no.
Just all large breeds. They're Rottweilers, they're big doodles, they're big Goldens, they're large breed dogs. But he had over 220 puppies. Went from
And which
0
one is it?
to Purina Sport 32. Went from 0 bitches in heat to 22. He called Marilyn and said, you're gonna have to send yourself a Dr. Greer down here to help me build onto the kennel. It's like, you do not know you put a hammer in my hand. So that's the kind of things that we see consistently, and I can tell you story after story after story, but that one's fairly dramatic in the improvement in fertility. So I'm just gonna tell you flat out, that's the way it goes. I feed Royal Canin at my house. I don't have any objections to Purina, it's just I feed Royal Canin. But those are the 2 diets that we recommend that we have the best fertility. But if that doesn't get you there, then there's some other fertility things that we do, so we can discuss some of those things more one-on-one. I like Be Strong, I like ICSB CF+, which is International Canine Semen Bank's canine fertility, their supplement, and even, again, it's made for male dogs, but I use it on bitches because they consistently cycle better. So there's some things that we can do nutritionally that can make a big difference without using any kind of drug interaction. Then the last thing is anti-inflammatories. On days 2, 3, and 4, and days 15, 16, and 17 post-ovulation in the bitch. And there were some studies that were published that showed that bitches that previously hadn't gotten pregnant, 50% of them did with that protocol. I use Medican, Meloxicam, we can certainly use Carprofen and Rivodil. In those scenarios, they're safe during those time periods. We've done about hundreds and hundreds of bitches that we've had success with. And I think what happens is the anti-inflammatory effect. So days 2, 3, and 4 post-ovulation, that's when the sperm gets up into the oviduct, and the egg meets the sperm in the oviduct. And so if there's swelling, inflammation, anything going on unhappy in the oviduct, you're not going to get fertilization. And then days 15 and 16 and 17, what happens on those days? Implantation. So now we've got a happy uterus. It's like, oh, sure, make a placenta. That's fine. You can hang out here for the next 52 days. No, please, because I'm at home. So I think those are the things that are happening from an anti-inflammatory perspective. And there are veterinarians who are like, oh, I'm not doing that. It's not safe. It's not labeled. We've got hundreds and hundreds of bitches that have done that protocol and not had any untoward effects. Does it work every time? No. But we're sticking foreign material, extender, and sperm into a uterus. That, and then we put it in with a catheter, whether you do it surgically or TCI, you're still putting a catheter in, you're causing some inflammatory changes. So doesn't it make sense to make the uterus catheter?
Well, I mean, during inflammation times, you have more immune cells kicking up what they're not
And
being
you have
out.
prostaglandins, and so Medican and Carprofen are anti-prostaglandins. So yes, we have a lot of happier things.
Makes sense.
Yeah, so it does make sense, and because there were published studies, I was comfortable doing it, and we've done it enough times now to say that's to get safe. Yeah.
Just a quick corollary food question. There's a big push in my group right now that you just have to rotate your food and not feed the same thing all the time. If you're feeding good food, why would you do that?
I know, and Dr. Zeller's wife, who's a biochemist, and quite brilliant, she's a PhD. She's always been a fan of that with her Bernese Mountain Dogs in the past, and now they have a Bernese Mountain Dog, their third one, that won't eat anything. Won't eat anything. Dr. Zeller spends an hour a day trying to get us not to eat. That's like insane to me. Like, who would have, my dogs are hard ones, right? There are people who think that rotating the diet will reduce the picky dog syndrome, that it may reduce the chances of some kind of a, I don't know. I don't know what they're thinking, but if you're feeding a high quality food, okay, fine. If you want to switch from salmon to chicken on Purina Sport 3020, okay, great. But I don't know that you have to necessarily go brand to brand. I think if you trust the brand, and let's face it, these big companies are not in the business of hurting your dogs. They spend millions and millions and millions of dollars to make a healthy dog food, and we see dogs living longer now than they have historically in the past. So I think it's kind of just, how people are sort of making dog food companies an enemy, because they're not here to kill you. You're here to keep your dog alive so they can eat dog food for as many years as they possibly can. You know. Makes sense.
So if the dog is not on one of those 2, how far in advance would you switch it over?
I like to do it before they come to feed. And for the bitches that aren't cycling well, the recommendations that we'll make will be to switch to one of those foods put them on B Strong, put them on ICS, BCF plus, and many of those bitches, if you've been sitting there staring at them and you haven't cooked the food, they haven't cooked the food, you switch that food. Katie, that is my repro tech that you probably all met and talked to. She came to me a couple of years ago with one of her bitches and she said, I want you to put her on, you're going to bring her in. I said, not until you do X, A, B, C. She's like, okay, fine, I'll do it. Okay. And on day 14, I got a picture of myself on her bitches back end. I get the best pictures. No, it's like, look, she's in heat. I'm like, yes. Yes. So it does work fairly well. It doesn't work on every bitch. Nothing works on every dog. Everything. But those are the things that we found to be useful. On rare occasions, I would use a course of antibiotics, but that is not the norm. The norm is the anti-inflammatory twice and the 2 nutritional supplements. So that's my basic protocol. And we do see an improvement in fertility, or at least a perceived improvement. There are bitches that I think get pregnant with surgical things that don't with TCIs. I always think TCI is the best approach because it's not invasive and it's easy on the bitch. You know, it's not an anesthetic procedure, it's not a surgical procedure, which are not without risk. But there are bitches that I think do, and when you think about, so when we put the catheter in the cervix and inseminate, it's passively, you know, we're pushing the semen forward, but when we do it surgically, I can encircle the cervix with my finger, thumb, and force the semen more cranial. So there probably are some bitches that will get pregnant with that additional force behind the delivery system. A normal dog should get pregnant with TCI process. But, okay, here's the other thing, is we work with a lot of commercial breeders in my world. And if those bitches don't get pregnant easily, if their stud dogs don't breed the bitch, if the bitch won't stand, if she doesn't get pregnant, if she can't whelp her litter on her own, or if you reach into the whelping box and she bites you, or if the bitch doesn't lactate or the puppies don't nurse, what happens? She's gone. What do we do in confirmation? This dog is so beautiful. I have to get puppies out of him/her. Oh yeah, he only had one testicle down at the beginning, but you know, it came down later. My breed has puppies that have, no. Testicles should be down at 3 weeks. What do we do with our bitches? Oh yeah, well, I have to go through all these things to get pregnant. Are we really breeding for the right things? Sometimes I think we really need to look in the mirror and say, okay, seriously, is this the right thing? I can't answer that. That's
We also breed our show dogs much later.
we do. They all have a career. They all have a slide of a dog laying on her side. She'd say, look, she's got on heels and everything. And that's what I say to people, if they have a career first, you know. And they do, they run these field dogs until they're 8 years old and then they bring in the lab and they go at 8 and they're like, okay, this is her only chance to get pregnant. Okay, great. She's 8. That's awesome. Anyone who's frozen semen from a dog that's been dead for 25 years.
Yeah, the rest of it was the thought of, you're not gonna put the money into showing them until you know that they're gonna have puppies. That used to be the thought in the seventies.
Yeah.
You didn't take them and want them finished as a puppy bitch. You didn't know she could produce before you put that money on
Right.
showing.
And now, you know, 2 years is that magic number for OFA.
Yeah.
But now we have DNA. We can test for 8 gajillion diseases
Early on.
when they're babies. And so Dr. Westra and I are working on a flow chart for breeding stock selection to help people kind of think through that process. And I think it's really important that we do that because we've got the ability to use that DNA to move us forward. Yes, until they're 2, you don't know for sure unless you do PENHIP or unless you do a prelim OFA. And prelim OFAs at 1 year are 90% accurate. So
I don't know about the PENHIP,
what do you mean?
personally.
Oh.
Do you like it or not like
I'm
it? Well,
not
be honest, because my long-term gut, is a PENHIP person.
Yeah, I'm not enthused.
Okay.
Do I do it? Yes. I'm not enthused about it. For several reasons. Not the least of which is Gail Smith in the footnote of one of his papers said Pembroke Welsh corgis are the exception to the rule that laxity of the hip doesn't contribute to hip dysplasia in that breed. That's what I breed Pembroke Welsh corgis. So I'm like, So I'm not enthused about it, but there are some tools that there are some opportunities that gives you that if you do them at 4 months of age, you can very quickly say this dog probably shouldn't be in my gene pool. If the hips aren't in and then the same zone,
Right.
then it's easy. You know, it's else. I mean, part of the problem is they have to use the database for what they have in the breed. And so if everybody in your breed went in with really crappy hips and you have average hips, you can look like a rock star. Or the vice versa can happen, especially in small numbers of breeds, like golden retrievers. We have, I don't know, thousands and thousands of dogs in the database, but you have the Barbet, you have an Otter Hound. What does that mean? You're compared against, what, 20 other dogs? 50 other dogs, and your dog can be like, it's a rock star even if it's average, or it can look horrible if it's, if it's good, just depending on where you fall. So I think all those things have to be factored in, and I keep telling people you don't breed for one trait. You have to look at the whole dog. There is no perfect dog. You have to look at the whole dog and really make a decision on where your priorities are. And every breed, for me, there's certain things that I think are absolutely never going to be in a breeding program. Those are, I rate genetic diseases on a 1, 2. That's my personal take. It doesn't mean it's yours. It doesn't mean for my breed it's the same as your breed, or for your breeding program it's the same. But if I have a level 1 and it's something you fix once, like in the middle of hernia, I think you fix it once, it's gone, it's done. You get to level 2, which are the chronically managed diseases like thyroid disease and allergies. It's easier to manage allergies than it used to be, but I still don't think we should be breeding dogs that are on side effect interpret medicines, to control their allergies. And then for me, the 3 are things that I think are never going to breed. And that's going to be crippling diseases, life-altering, life-shortening diseases, crippling diseases for orthopedics. And maybe that includes cruciates, because we really haven't talked much about where some of those things fall. We don't have answers for all this stuff. Number 2 for me are things like seizures, depending on the kind of seizure. Some seizures are not genetic, but a lot of them probably are. And again, we have one test coming, but we don't have, what's that?
Before?
Yeah. So we have that, but then we have things like bad temperament. And if I have to muzzle your dog to collect semen from him, or to put the semen into a bitch, really? I'm supposed to breed this? I have a video of Katie that was, we took in our examiner when I was doing some video for revival for semen development. And it was a dog that we couldn't have a bitch in the room because he was going to be aggressive toward her. And she got down behind him, and I saw her take this very careful step back as the dog did one of these things. And I'm like, oh yeah, we don't need that. So I have different priorities than you might. If you have a dog that's known to be aggressive, maybe you accept that. But I'm never going to accept that breeding program for these dogs, because that's just not okay. My dogs need to be nice dogs, or they're not going to be loved. But that's me.
You're not breeding Malinois, you're breeding someone's pet.
Exactly. If I were breeding Malinois for performance, if I was doing Mondio ring or raising for the security, I might look at it differently. But I'm not. I'm breeding dogs that sleep on the foot of people's beds and sleep with their kids.
I have a question going back to nutrition. So the nutrition you're recommending for pre-breeding and breeding, how does that help? I'm assuming it does. Post-breeding for, post-whelping for the female's recovery. Because I've seen a lot more infections in my bitches since COVID, I would like to say, and I've heard the foods have changed some during that
You mean
time.
like metritis?
Yeah.
Okay. And that probably has more to do with contractility, which can relate to calcium, it can relate to other things. So if she doesn't have good uterine contractility post-whelping, she may have fluid accumulation, she may have fragments of the placenta left behind that would lead to metritis. So there could be a nutritional component to it, but it may also be a management. It just be that we're not, maybe you need to use oxytocin on those bitches and typically have it. Maybe there's some things that
I typically do actually.
and I'm a big fan of calcium. I know there are people who don't think it helps for whelping and metritis, but I think it.
Well, I've been personally feeding ice cream after whelping since you had taught about that. I don't know how many years ago I was learning things for that. So I know they are getting that, and I know they're getting the other. So I'm back to thinking nutrition, because I also know what the placentas.
Yeah, but there's not enough calcium in ice cream to do everything we need.
So
There's calories in ice cream, there's fluid in ice cream. So for bitches that aren't eating very well, I think it's good. But I get calcium gel or calcium injections.
Okay.
So I will augment it with more calcium.
All right.
Just put some.
Yeah. I only get like 12 a day.
For post?
Yeah.
Food?
Yeah, that's.
So I'm curious to know what you've read or seen about the mandiosarcoma studies going on.
I don't know much about the most recent stuff. I know I heard Dr. Modiello from Minnesota 2 or 3 years ago, and I know there's stuff going on. What do you know for DNA? I mean, they've been looking for DNA on hemangiosarcoma. My sister's dog was in one of the studies at University of Minnesota. Lymphosarcoma, hemangiosarcoma, those two diseases, if we could find DNA tests for those, that would totally be a game changer for so many people, so many breeds. I don't know what kind of progress they've made, and to me, it's really frustrating as a non-geneticist to say, but we have all these dogs with it, why can't you figure this? Like, why did you find this genetic disease for this weird disease? Because when they're sorting out genetics, you can explain this better, when there's one defect, it's easier for that to show up against 1,000 dogs if there's, how do you figure it out? It's complicated. You wanna.
Yeah, so so the difference here is we're looking at a single mutation, a single causal mutation versus a polygenic. It requires multiple. Cancer is off the hook when it comes to that. Multiple systems are broken down. And so, you know, when we look for a genetic disease, first of all, there's a presentation. Somebody's like, my dog's acting weird, you take it to the vet, the vet's smart enough to recognize that this is not, it doesn't fall within a regular category. And so we start comparing that dog to the known, you know, published sequences against all the other dogs within that breed or sample size. And all of a sudden, you can see a very, very kind of straightforward, there's a mutation on chromosome 12 that's different from any dog. And then we test all the related dogs to that one, and we see, yeah, it's true that any dog homozygous for this mutation is going to show up with this disease. That's a very simplified version of how we get to these disease test results. But those are what I call low-hanging fruit. When things start getting more complicated is when we have like an easy example of this is dermatomyositis in collie and Sheltie, is that we know that is haplotype, which means it's a whole segment of genetics, and that's why we can only, and this is what my next talk will be about, is all we can identify is risk, meaning we don't know the causal mutation for it, and in a lot of cases we can't. It won't be any one thing because there's a number of different ways, like epilepsy, in which a dog can become epileptic. You know, so that's the difference between a simple, easy, straightforward, love it, you know, great, found this single mutation, it breeds true, we checked all the related animals, any dog homozygous for this mutation, we have to put them in either affected or at risk. Then things get more complicated. And yes, when we start talking about cancer, going back to what the topic is, it becomes like how many different pathways break down for a tumor to result. You know, and can they result from different metabolic pathways than we have, obviously, and that's why we have the types of cancer and the severities of cancer. Because all of this is just here, and I'm going to touch upon this briefly when we talk about hip dysplasia, because they found some similarities between genetics of hip dysplasia and a potential relationship to cancer. Not a strong one, but it's interesting to start thinking about it conceptually about that this is a breakdown in a normal metabolic or normal physiologic pathway.
Yeah, like the immune system, like.
Exactly.
1,000 other things have to go wrong.
Right.
The environmental exposure, there's so many variables. So it is frustrating for us as breeders to say, why can't we just have a DNA test for the bug? And why can't we just do that? It'd be lovely, wouldn't it?
Yeah.
But
Yeah.
you still have to breed.
It at least avoid that in the breeding. So that would be good. Other questions?
Let's just sort of comment on a couple of things here. So for the Irish Forest Spaniels, the European Irish Forest Spaniels are far bigger than those overall than the American. So I looked at this keeping track and the number of pups per litter in the Irish Forest Spaniels in the United States. The second thing that's interesting about cancer is the English Irish Forest Spaniels went through 15 years where they had a high cancers under 2 to 3 years. So, which the United States about.
So is our US population becoming more line bred, more tightly line bred, COI changing, so we're getting smaller and smaller and smaller litters because of that, and genetics. Is it a difference in the nutrition because those diets
I
are
think it's a
very
different
different?
nutrition, because the show Irish Forestmans, they were, you know, the uncle, niece for 3 generations, half of that.
So they're breeding really tight.
One male, the male from the United States over there, and sired 27 litters. There, I mean, just huge. And every generation, there's another male that in England they all breed to. Okay, so they sired 15, 27 litters. You know.
So you need more tripe in the
I think so.
I think it's better quality whiskey in here.
they all like. And they do all like, and they want it unboxed, not the stuff in the can, they want the gross green. One is the reticulum. So if you look at a cow, they always say they have 4 stomachs, right? They really have 1 true stomach and 3 other compartments. Right is from the reticulum. So when the cow swallows her food, it drops into the reticulum and then they chew it and then it comes eventually back into their rumen. The rumen is a great big plain sac. The reticulum is a relatively small part of the stomach and it's got this honeycomb appearance. So if you go to the grocery store, like if you go to a Mexican grocery store in Milwaukee, you'll see tripe in there. You know, and it should be green unwashed. It should have like the cows. Yeah, but they feed a lot of tripe. A lot. It's like, and I have a can here sitting on my kitchen counter right now. I don't think it's green. I didn't open it. I didn't have to taste it, but but there are definitely cultural differences between the others. No.
But what's interesting about your point is you're saying in Europe they're using popular sire, they can still use popular sire.
Yeah, they do.
That tends to have a negative effect on your COI.
If they get a big winning sire, they'll sire 13 litters. I mean, for a breed that's so small, yeah, it's a lot of litters. The litters aren't small size, they're like in the level.
Those are nice litters. Okay, what else? So moved it.
I just, the fact that she said English Irish.
I know, I was saying that too, it's like, wait, what, English Irish, one's in England,
Yeah.
or Irish.
Yes. So when you have, like, when you're feeding the right nutrition, and you're like doing your progesterone testing, you're doing ovulation, what is like a benchmark pregnancy rate? Like what would be like,
What percentage of bitches should get pregnant?
yeah.
It should be 80%. Or higher. And the other thing to remember is not all progesterone is created equal. Not all progesterone interpretation is created equal. And you can't just go 5 is magic. And I'm counting from there. We own 7 progesterone machines. I speak progesterone. So I see results come from other hospitals, other clinics, and I'll get printouts from this. So the mini vitus gives you a completely different result. Factor in factor, so there's Toso, Catalyst, Imulite, mini vitus, maybe this depending on how you say it, BioNote, there's a little one and a big one, there's Health Cube, and then there's progesterone machines I've never even heard of. Every week I heard somebody talk about progesterone. So there's a lot of that, and we're super anal here about our progesterone. I worked in a human hospital lab. Heidi that works managing now this in a human hospital lab. She's a med tech and has a degree in med tech. Was there for 10 years, and we do quality control on our machines. We quarterly used to send them all to Marshfield, and Marshfield is gone, and we do a quality assurance program where we can standard deviations and we can see how accurate our machine was compared to anybody or Imulite that they were running. Not all veterinary clinics do that, and you're like, oh, our machine is always perfect. No, it's not always perfect. If I get a result that doesn't make sense, I'm running it on 2 other machines. I'm going back and looking at my quality control. I'm running standards and controls every single day on the machine. We're doing that stuff. But the people who do Catalyst, people who do Toso may be more relaxed about it than I am. So I'm not, I'm always just on that. But you can't just look at that number. You have to look at what the trends are. Don't walk up to me with a record and say, her progesterone is 4.7 today, what day do we breathe? No, I want to see the whole string of the progesterones. I want to see one that goes over 5, well over 5, to make sure you can completely your ovulation. My own personal bitch, little Miss Phoebe, has had 2 heat cycles in the last 6 months. That she did she got to 5 and she's like, just kidding. You just spent money on sperm. Oh well. So there's a lot of variables in that. So progesterone testing is not all created in that, just to say that.
Yes.
So with that,
I know too well. You're basic, like you want so what I'm hearing is it's not the value, it's the trend. And to get an accurate trend, you're gonna need multiples at the right point. So what, like how early you start, like what is like kind of your best practice on the progesterone?
typically we'll say on day 6, but I have bitches that ovulate on day 2, and we have bitches that don't ovulate until day 21. So it depends on the bitch. And remember, just because she had a heat cycle this way one time doesn't mean she's gonna do it that way everything, or you may have missed it. We had two very experienced breeders here this week, very experienced people with more than 30 years of experience that both had accidental breedings at their house, no timing, no idea, big litters, big puppies. One was out of town when breeding took place. You can come home and your husband can say, well, I don't know, I was watching her and she didn't seem like she was in heat. You go on for your first progesterone is 27. Oh, I think you missed something. Or some bitches are really clean. It's nice to have that intact male stuck up in your house that will say, this one's in heat. On the other hand, you can have accidental breedings. One of them happened to us. Yes, you can have crate breedings, you can have through the chain link fence breedings, so having a step dog in the house does have a downside to it.
The percentage feedback I think this is possible.
Well, I call it been in two toddlers, so I'm just doing.
My son came home from college, and he usually would come here because we have two washers and dryers, so he would do his laundry. He called us one day from home and said, I'm home. I brought my laundry home and I let the dogs out, and I said, you what? I was like, oh, I love you. Me. And then when it says, I wonder if when accidental breeding happened, it's like, that would never happen at my house. Either you're lucky or you're lucky.
Very lucky.
So all one thing, this is a chance that we still have kids.
Yeah, but you still could be looking at that dog going, you're pregnant. How did that happen? And which one was it? Man.
Well, then there would be an
Profiling there.
I have a question on, okay, with the genetics for the people here. Have they found the copper storage disease issues here for the terriers and the Doberman? Have they found that one yet?
For the Doberman,
Yeah, I heard some rumor that they might have.
well, the COM-B mutation is for the Bedlington. You know, that's kind of the classic, that's the known one. Yeah, I don't know about the Doberman. I do know what's interesting is that we have found it in other breeds outside of the Bedlington. The problem comes is that the clinical trials I'm not aware of, say that they don't exist, to establish that there is an association with presentation of the disease and presence of the mutation.
That's one of those pair one genetic, you know, that dog, I've seen, I've had a couple family members of a rescue dog that ended up with that, and it's just devastating.
Yeah, we have labs with copper storage disease as well, so there are some breeds, but just because it's a mutation in one breed doesn't mean it's the same mutation. And that's where some people have gotten in trouble like BWD. You know, they test, I have friends that test their quarantines for BWD. Why are you doing that? 'Cause it's only validated in the study. Like, well, because then people listen to the study. Okay.
In the future.
I have a question about the timing of the progesterone. So usually when I people come here or that's sort of like, you know, it's done like every 2 days. And I just understand your own leader, this veterinarian, says that she does it like every couple of hours that she brings the dog to the vet. And when she did that with frozen semen that had been frozen for 20 years, she got 9 puppies.
Yeah,
Do you
so
need to do it every hour?
not typically, there is a clinic in Utah, the Midwest, stop it here, that does twice a day testing. He does primarily greyhounds and has a very high percentage of success, but he keeps the greyhounds there. They're racing greyhounds, they're pet greyhounds. It's, you know, so are there some variables? Yeah, we want to do twice a day for husbands. We're good with that.
I'm taking on
Most people are fans of that. Most people want to come every 2 or 3 days and they want us to do our best to do the best. And generally we do. That's one of the reasons LH testing has been challenging, is because you have to test every 24 hours to find the LH surge. And it still tells you to read 5 to 6 days afterwards. So it still gives you a 24-hour window. And if your frozen semen isn't highly viable and it's only for a few hours, you need to nail it down as much as possible. But a little bit just comes in the morning. I'll be like, well, she's at 18. I really want her to be at 20. That was when we were doing the TOSA. Now we're pushed out back to 15 on our Immunite. But we may say, if it's only at 12 this morning, come back this afternoon. We'll do another one we may push it back to that and do it for 12 hours later, or come back the next morning if it's in the afternoon. So we'll play with that, because we want to get it to that closest 12-hour period.
And that's the LH you're looking at.
The progesterone.
Yes, yeah.
So it depends on the client's tolerance for that, because some clients are like, I'm only gonna test once. Oh, okay. But we can pick the right day. But I remember somebody in the 37 for progesterone.
I didn't do.
On a prolonged progesterone test, I remember only progesterone test, and ended up with a.
Well,
On the
Yeah,
4th
yeah.
of July.
on the 3rd of July. So I had done progesterone at another place. And the progesterone were like 2 or 3. They said, well, come back 3 days later. And I said, fine. And then I didn't find out until the day later, which was a Tuesday. Well, it was 19 on Monday. So now I'm frantically calling Marty because we were using a male that had never been bred and wouldn't read her. We did a TCI. Got very kindly got me in on Wednesday, did the TCI. And one machine said just on this 27. She repeated it on a different machine the day before the C-section. And it was 37. So she had, the reading took me just was 37.
So, and it's variable, because not every bitch rises the same way. It's the same with reverse progesterone, not every bitch drops the same way. They don't drop from 10 to 8 to 4 to 2. They don't do that. They can sit here at 3 for a week and a half, and they can drop from 10 to 1 overnight. So every bitch is different, and that's part of the restriction. And I think there's probably a few, we have one line of dogs that our progesterone machine, we just get these aberrant weird results. I don't know why, but that particular line of dogs just never felt to me. So,
But you have to get pregnant and have pets.
produce that.
Well,
But it's a low entry group, but let's say it's in the bottom 98.
My scenario was, I was helping a friend out who couldn't be around. She didn't know when the girl got bred. She had to have a C-section because she was accidentally bred. Fast forward, prior to breeding, she was hit by a truck, broke her pelvis, and some other things. So she had to have a C-section.
It wasn't an opening for puppies.
No, there wasn't. And so I'm running up here or Sun Prairie, helping this friend out, and wasn't it like 2 weeks? It was about 2 weeks of doing progesterone testing. And I came up on Saturday and they said, well, no, she's not ready. And it was Sunday night, because we had him on a Monday, it was Sunday night. And I'm like, well, okay, nothing's happening. And we also did that monitor system, which I totally thought was like a fluke, did not believe it at all. I'm like, no, this is, oh yeah, well, we found out that thing worked, because in the middle of the night at about 12:30, she goes into her stage of labor. And I'm like, I am so screwed. I called my friend and I said, what do you want me to do? And she says, let's wait till the morning. I'm like, okay. I literally got up here, they pulled progesterone, and she's like, so are we doing C-section? And I'm like, yeah, she's clearly in labor. She's been pushing just recently, and literally got her in the next room, and the water bubble came out. I'm like, yeah, it's time.
So you get all your. And just remember, just because you didn't plan to breed this, because I'm planning. They planted themselves. Yeah. Right. They planted for weeks. Anyway, we have about 15 minutes till I'm gonna put this guy down. More questions? Yeah.
Quick one, what's the current status of brucellosis testing, in-house or sent out?
Okay,
Where are we at now?
great question. So brucellosis currently does not have an FDA approved test for use in the United States.
Oh, how can that be? Interesting.
Because Zoetis stopped making.
Who stopped making?
Zoetis. So the first test came to market in the 1970s. They made by Pittman Morse, over the course of mergers and acquisitions. For Pittman Moore became Smith Kline, which became Smith Kline Beecham, which became Pfizer, which became Zoetis, which became, we're not gonna have this test. And I can't get an answer, even though one of the guys on the Theria board is on the upper level management at Zoetis, I'm not getting an answer. So the Theriogenology group last February, I was at the meeting because I'm on board, and I said, I really think we need to have a statement, a position statement by the Theriogenology organization. So veterinarians that aren't theriogenologists or aren't involved with theriogenology directly have us as the benchmark for what we should be doing. They said, great, you're in charge of it. So I was, and so we published a position statement, and there was a lot of discussion at the annual meeting, over an hour discussion. And essentially, Cornell has a multiplex test that is what most people are using. There are 22 state labs, and if you go to the Theriogenology, therio.org website, and go to position statement, those 22 labs are listed there for which states have an accredited test, or are an accredited lab. That does not include Antech, that does not include IDEX. It includes a number of state labs, it does not include those two big labs. And so we have to reopen the discussion because there are people on the Therio list that are having a little fit because we didn't include those or because of this. And I'm like, where were you when we had a committee? And where were you when we were voting on this? Because you all have a voice at that point. So we're gonna reopen it probably tomorrow. So basically, there are a number of diagnostic labs, 22 or so in the country that you can send them to. Some of them are running the non-accredited tests, but we are assuming because they're an accredited lab that they are doing some kind of test validation with a control to make sure that their negative and positive controls are actually giving us accurate test results. Right now, the BioNote test you can buy, there's a test from China you can buy on eBay. Go ahead, knock yourself out, buy it, run it, but it's not validated. And I'm not willing as a veterinarian to accept the liability of running a test that is not a validated test in the States, because if you come back, I say you're negative, but you are really positive, and now you infect your bitch, your kennel, your dog, the dog that you bred to, and all the humans around it because it's a zoonotic disease. I'm not willing to take that liability. There are veterinarians who are not aware of this or who are being cavalier about it. And there's one veterinarian who's running both an in-office test to give a quick answer and then still sending it out, which means I have to charge you twice as much. So right now, not that's running the validated test.
How long are you
For now.
telling people to leave for the results to
It's taking a week to 10 days.
come back? Okay.
So you want to be testing your dogs before they're ready to breed. You can't come in that day and expect a result in 20 minutes, like we historically were in for 40 years, 35 years.
Okay.
So it was a very good test for the aspect that it was very sensitive, but it wasn't very specific. So I don't know if Joanne's got legal advice from that, I don't know if they couldn't be agents. I don't know where the problem came in with the in-house test, but you can buy it. You could go on eBay right now and buy it, but I wouldn't recommend it because we don't have validation. And I think you would validate the test if we're making decisions about something as impactful as losing an entire breeding program and potentially doing this. When I was in undergrad, I worked at a human hospital. I remember drawing blood on a human patient, a veterinarian that had brucellosis. He was a sick dude. Let me tell you, I looked at him and said, never want that disease. And so it makes you really sick. It's called undulant fever for a reason, because it never goes away. Once it's in your bone marrow, it's with you forever. It's there forever. So don't play around with brucellosis. There's things that you can go for, not brucellosis.
So if you think they're getting pregnant, or coming into season in a month, do you wait until you see swelling, or do you do it like?
Come in there. And it's also a great time for your bitches to draw your heartworm test with your Lyme test, Lyme anaplasmosis and Ehrlichia, because we've seen quite a few dogs get really sick during pregnancy with Lyme disease. So if you come in a month ahead and you do have a Lyme positive test, we have time to run C6, time to put her on doxycycline, time to clear that up, because the immunosuppressive effect of pregnancy will allow those tick-borne diseases to exacerbate. And we've had two heartworm positive dogs that are native to Wisconsin this year in breeding kennels that were on preventive and allegedly protected. The last thing you want to do is have a pregnant heartworm positive. That's pretty obvious.
So if you don't know when the fish is gonna come in season, just,
Yes.
you just kind of 3 months, 4 months, whatever.
Yeah, because most people are gonna accept that result as being contemporaneous enough that you had to make a decision to prevent it. And your stud dogs should be tested once or twice a year depending on frequency of use. So again, that shouldn't be a last minute event.
door and give a test.
Wanted to jump question?
You said something about Wolfwise, didn't I?
Oh, yeah.
yes,
I would like to know more about it.
So WellWise is uterine contraction monitoring station in Stone, Colorado, run by Karen Coakley. She's an obstetrical nurse. And they use the same equipment that they use on people. It's a transducer that straps to the bitch's abdomen. It's about this big around, lays flat in her abdomen. And if you're using the monitoring fluids, you pay for like a week or 10 days of service.
And you don't have to put a phone line though.
Right.
Yeah.
You have to have a landline, which was interesting because we were doing it late at night because that's when we had time to do it. So we'd have to drive to either my parents' house or my other half's parents' house to use their landline and then drive us home to go, oh, okay, well, let's see, nothing conducive to labor, okay.
So you put it in our abdomen with the Velcro strap, and then once a day in the morning for an hour, and in the afternoon or evening for an hour, you monitor her uterine contractility. Along with that comes a second piece of equipment, a fetal Doppler, so you can monitor fetal heart rates. So during labor, they can tell you, because Karen has a 24-hour service with other people, not just her. They can look at uterine contractility. They can advise you with your veterinarian's input on writing orders. Should we give calcium? Should we give oxytocin? How much should we give? Is it being effective? It looks like she has a log jam. Does it look like something's not right about this? What are the fetal heart rates doing? And when do we pull the trigger on running in for a C-section versus going, just sit tight, another dose of calcium, get back, prepare. There's gonna be a puppy showing up in 3 minutes. It's a really cool service.
And the only thing is the Doppler connected to like headphones or something that you have on your head, because I used it once and my jack just like lost
The sounds can be a little, they're scratchy, you know, you don't have Doppler sounds.
it. Yeah, she checked out.
Yeah, but
Oh, yeah.
But it's a way for you to assess the bitch's labor and it works also for preterm labor bitches, so bitches that drop their progesterone prematurely. You can monitor to see if your terbutaline and progesterone and your other medical management of preterm labor is effective. It's a great service. Some people don't like it because the technology is disruptive to labor. Other people wouldn't well without it. So
It was pretty cool. I mean, I was like, I don't know how this thing's gonna work.
But Greg's pretty tech. So you kind of have to have a techy person in your life to.
Is it constant?
I'm not sure what the service is now. It's around $400 or $500 for the whole thing, for shipping the other equipment, using the equipment. And I actually do have one of them here in the practice. If somebody doesn't, because Karen doesn't have enough equipment always to go around. So I have loaned it out to clients for rental basis as well. So it's in the hundreds of dollars. And if it saves you a C-section or something, then it may be.
ER C-section is expensive.
Yes, and then they hover over her with a pair of scissors to cut out her uterus. Yeah.
Well, if you're in an area though, you can even find someone that'll do C-section for you off office.
Yeah, even in ER, I had, this last summer, I had, ER wouldn't do it, and they're like, we don't have space for you, 2 different ERs. No, my pup was already gone, so I just really kept my dog going till morning and got her to the regular vet. It's kind of crazy like that you can't have somebody help you.
But I've had cats that couldn't breathe that they didn't have capacity for. We've had dogs bleeding capacity for. It's kind of a current event, kind of thing that's going on in the street. But it's going on in the business.
Oh, yeah, we don't.
Yes, you better hope that you stick at the right time.
In the right place.
Totally, it's it.
But probably that's what you have heard. All right, ready?
Well, it's also. Okay, great.
All right, I will go ahead and move you. Dr. Westra from. Gonna talk.
So this part of it is going to build on what we talked about before. Again, I don't want to bore you guys. But what I like about this is that I'm going to use some big examples to kind of explain some of the complexity that we do with polygenetics. Just simply means multiple genes are involved in these traits. And so I'm going to use 2 examples of size hip dysplasia to show how we understand that multiple mutations are involved in the presentation or the phenotype of any of the of what we're discussing. That I want you to understand why we can't suddenly just like have a simple test for hip dysplasia and we're good to go. And then I'm going to bring back the specter from this morning of chondrodystrophy because I use it as an example of breeding for risk because it affects so many different breeds of dogs. And we can talk about that, and this kind of ties into what Dr. Greer talked about earlier in terms of that priority and why and how she starts to rate dogs for what he thinks is an acceptable risk and what isn't. I'm not gonna go through this again, by this time you guys know me, except for I would want to point out, these are my girls. And the beautiful thing about this right now is that I've gone to fully remote work, because I literally am sitting at my computer and these are on one foot and the other one's laying on my other foot. And I think it's like, you know, I don't ever want to go back to the office again. It's kind of funny. I will say this, Neogen, I'm gonna include, because I was asked to, some slides about why you should test with PawPrint Neogen versus some of the other companies out there. I'm gonna try to speak about testing as a whole. I'm gonna try to be polite and not throw any of my competitors under the bus too hard. But if we can explain what the difference is between the laboratories so that you understand why it matters. Just like with what progesterone test you use, just like, you know, with what brucellosis test you use, there is a variation in why I think one is better than the other. All right, so yeah, let's get right into that. So when you think about genetic testing, there's specifically two types of tests that are available on the market, and that's breed-specific testing versus a genetic screening. Okay, and the simple way to think about it, breed-specific is just that. You are ordering the tests which are a known association with your breed. PawPrint, that basically is bread and butter. We have our essential panels, which are those mutations which have a public known association to affect or create clinical disease in that dog. Right? The beautiful part of it is that you're not getting tests that you don't need. You don't need to test for dilated cardiomyopathy. That only affects the Doberman, and you have the Danish, that's what I could think. I used to say Swedish farm dog.
Danish, Swedish farm dog.
Swedish farm dog. I'm gonna come out here knowing more. I mean, having learned more. And so that's the advantage to breed specific is you're basically getting exactly what you need. Like in the terms of insurance, versus the guidelines. Other laboratories that do this is like the Veterinary Genetics Lab, PTL, out of UC Davis, and Animal Genetics. They basically have a panel of tests that are set up for your breed of dog. Kind of makes it a little bit less like, are you going to? You contrast that with the genetic screen. Genetic screen does not matter what the breed of your dog is. We're going to test your dog's DNA sample and a whole library of tests that we can package on our chip or whatever. This would be like wisdom panel, the canine health check, which is our version of it, and then what's hopefully coming out in the not too distant future is an AKC DNA product. And then the advantage you have with genetic screening is that oversimplifies it. It doesn't matter. You're going to get test results back for everything. And if you're working with the type of dog in which you can come under every color under the sun, or you're looking for very specific traits or something, then you're going to get all of that information without having to a la carte order exactly everything you need. But that comes with the problem is that you're going to get the answers to questions you didn't ask, which suddenly now your Australian Shepherd is going to come back carrying 1 or 2 copies of the mutation which causes dilated cardiomyopathy in the Doberman. Does it cause disease in the Australian Shepherd? It hasn't to date, but we don't know. So now you're left with this. Now you have to explain something which can be problematic. So one is like it can become very simple, like I don't think about it, just get the screening test, get the embark, and you're done. Or I would say I prefer you to get the canine health check. But you can get all of that information for one price. It can be a more economical route versus PawPrint, where everything is specific to that breed. I think it was you that threw out there, like God bless Chick or something like that. You made a comment to that Chick.
Well, why was being sarcastic after that?
No, I got you. I felt that.
I mean, I'm not
No, I want to talk about that to a degree. So this kind of just shows you that the breed testing is less confusing. But one of the advantages of PawPrint is if you do a PawPrint test, because we're basically focusing this down to what is important to that breed of dog, it gives you the access to our peripheral services that we offer, such as Clear by Parentage, which means basically if the parents don't have it, the puppy can't get it. This works well if you have a rather large breeding program, and then you tested the parents, and you know that the parents are clear for everything. What this genetic test does is it establishes that this puppy came from those parents, and therefore it should be genetically clear. Another thing is the PawPrint Pedigrees, which is our own independent website, which is a place for you to share your genetic results. I love the thematic music. I feel like I should be like waving a flag or something. The thing is that so often when we're breeding, we have to like convince our puppy buyers or the people that are partaking of our product that we are honest and reputable. And the best way to do that is to have something where you're not maintaining it, you voluntarily upweight the results of this and say, don't take my word for it, don't look at the piece of paper that I'm handing you, go look for yourself, trust and verify your own. And that's what we do with PawPrint pedigrees. And then DNA profiling, when you need a who's your daddy situation, parentage and profiling are available for all the reasons that we just talked about. So that can be important. And I say if there's a husband involved in your breeding program, you're going to need to use those things. I hear it so often. I get it on the phone all the time. So I left my husband alone, and I'm like, "Where's your sister? We're barely capable." And it is quite funny. And then the other one is when we get disputed results. You know, in other words, like there is no way my dog can be a blankety blank 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 because I know, and I've done this, that, and the other. Slow down, take a breath. Let's work it backwards. Let's solve the problem. And invariably, it's like, are there any other males in the house? And they're like, well, yes, but you know, and it always comes back to, oh no, you know, like there's this huge light bulb moment where suddenly parentage is an issue, and that's why, you know, your Merle puppy shouldn't have been fathered by that tri-colored dog, but there was a Merle dog in the house, you know, so it's like, we can figure it, that's oversimplification, but that's what the advantage of that is. I put in here one thing to understand, and this is what separates Neogen PawPrint from the other testing companies. We are the laboratory, all right? Many of the other services use a service provider. Embark is a wonderful marketing company. If you've ever been on the internet and done anything dog related, an Embark commercial has come up on your webpage. I am jealous with how well Embark is out there, getting Embark out there. But the thing is they use a service provider, and they don't hide it. You go on their website, and you will see that they use another company, a very good company. But we are one of those companies. So the advantage is the quality control is inherent in our system. And if there is a problem, we can work it back to find out, was it sample management? You know, was there contamination in the sample? It's like we have the access of doing that. The other advantage that we have is that we are not limited by technology. You go on the Embark website, again, I'm not throwing them under the bus, I'm just explaining as an example. They will be very proud, and they should be, of their Illumina chip that they use. It's called an array. And that's basically how they're able to do 200 and some odd tests on one sample, is that they've got them all set up on an array chip that gets processed, and that's how they get that. It's a very accurate, it's a very good technology, but they can't add new tests to it very easily, and they can't do anything that doesn't work, because not every mutation works on that technology. And so therefore, some of the tests they will never be able to offer. Whereas we have that advantage because we do have access to all the toys, is that we can offer a test like Lafora. We can offer a test for copper toxicosis in the Labrador because that doesn't work on a chip at this point in time. So we have these advantages of being able to offer what I would call very niche tests that sometimes aren't through the more comprehensive array. Now, do we use array testing? Yes, it's a very economical way to do a lot of tests, and it's accurate. So we do employ that technology. It's just not our only, you know, we're not a one-trick pony. Now, to show you just an example, this is the Australian Labradoodle. I have this slide available, so I put it in there. Sorry if anybody has strong feelings about the Australian Labradoodle. But this just shows you the essential panel and the diseases that we are there. And then on the left there, you can see the reason, or this is how we build our essential panels. And it has to do with, one, the allele frequency within our testing. We have a benchmark. If the test is above at least 1% of the population of dogs that we test for, we're going to call it essential. Now, 1% seems like a pretty low bar, but when we're talking about genetic mutation, that's huge. I mean, that prevalence in the population means that it's out there and that we need to be sensitive towards that. The other way we determine what's essential is through communication with the breed club. Breed club is like, well, we've got a really big problem with early onset PRA, and we want to start testing our dogs for it. That's another reason why we will include it. It also works the opposite way, is that when we bring a new test online, we haven't tested a whole lot of dogs. So we really don't know or have any idea of why we would include that test or not. So we'll put it on our essential to basically force you to test for it, because we wanna know, is it real or not? Now, in a perfect world, when we aren't doing like 6 other projects on top of our regular job, we review these on a regular basis. And so like the RDOSD1 mutation, oh, there it goes. It's not working. The RDSOSD1 mutation in von Willebrand's is under less %. And so I just reached out to our directors committee and said, we need to review this panel. And I have this up here because I just spoke with the Australian Labradoodle Club, and I said, this needs to be updated. And so as a result, as people do their job and breed away from these disease-causing mutations, the frequency goes down. Usually within 1 to 3 years, you can make a significant reduction in the presence of that mutation. So as such, we would demote tests. Now, it seems like a poor business model that we would constantly be pulling tests off, so guess what? We find out new mutations every year, so there's always something to replace it with.
So I have a question, why are there two, you have a progressive retinal atrophy conrod dystrophy before and able down there also?
Yep, so with progressive retinal atrophy, of which there are several, we know that there are multiple mutations which cause the same disease. So progressive retinal atrophy is a destruction in the posterior portion of the eye. Basically, the blood vessels to the retina become attenuated, or they're basically too small. As such, the retina doesn't get enough nutrients, and it starts to atrophy or degrade. Now, we have identified over 35 different mutations that cause this disease, either in all breeds, some breeds, or very specific breeds. Within the Australian Labradoodle, we know that the CRD4 mutation, the PRCD mutation, and the RCD4 mutation are the same. Yes, there is a difference between cone-rod dystrophy and rod-cone dystrophy. Yes, I want to punch the scientist in the face who made that determination, because nothing is more confusing to the general public than something where it's basically we're transpositioning just a word. But we're talking about an entirely different variant when I talk about CRD4 versus RCD4. Okay. Just, yeah, I hate it. I'm like, really? That's the best you can come up with? We couldn't call it like, Bob and Charlie. They did it for a reason, and as such, those are two completely separate mutations which produce the disease, progressive retinal atrophy. Now, of those 3 tests, you guys are probably pretty familiar with PRCD, progressive rod degeneration. That one is found across many breeds, and at this point in time, we believe it to be completely penetrant. When we talk about the penetrance of the mutation, we talk about how likely is it for a dog to be homozygous for that mutation and actually present the disease. If it's got 2 copies of the PRCD, it likely is going to become clinical. Contrast that with the CRD4 that has what we call incomplete penetrance, which means there are a lot of dogs running around out there with 2 copies of that mutation and they're seeing just fine. But the fact is that we have associated dogs with that mutation to present with the disease. So one has incomplete penetrance, the other has complete penetrance. And these are things that you need to be thinking about when you are determining about either one, the genetic test result that you get, or what genetic test that you order. Because this will factor in, especially when we start talking about chondrodystrophy or some of the other tests that are out there. Now, our screening product, which is technologically superior, and in fact that it is more comprehensive than the other screening products that are out there, so I really like it. It's the Canine Health Check. It tests for over 325 different tests, which makes it one of the more comprehensive tests out there, more than MBARC, more than Wisdom Panel. And it also benefits from the fact that these were tests that we developed.
Great catch.
Yeah, I dropped it.
But now we're looking past. All of the tests on the Canine Health Check were developed through our PawPrint brand, and we basically brought them over into our screening product, which is part of the reason why we were able to offer more tests on this platform. And it is also, like I said, it's an economic version if you're really interested in seeing all the genotypes for the co-colors and traits, because they are included. Now, I'm not leaving them out. We also do a screening for cats. This is the preferred screening now by the Cat Fanciers Association. And it is the largest genetic screening available for cats, looking for over 120 different diseases along with coat colors and traits. The one thing I like to talk to people is it also does a genetic blood typing, which has some clinical value. Now, what we do not offer, okay, we're talking about distinctions about Neogen versus all the other competitors, is that we do not offer a breed identification product. And for most of you in here, that's like great, didn't need it anyway. I know what breed of dog that is. And that's fine, and I agree and I support that. The thing about breed identification is in my opinion, it's fun. It is fun. It's always good, and it's interesting to talk about and share with people. And for the pet owner who wants to know more about their dog, breed identification, has some value. It does not establish a purebred dog. We were just arguing about golden doodles. Golden doodle associate Ghana. I don't know what I'd say it's for.
Golden Doodle Association.
Golden doodle. North America. They're using an embark test to establish whether or not you can be included in their club. Right? And I don't want to see breed identification used in that manner because it's a misapplication of the technology. The technology is sound, it works, and it does what it's meant to do. The problem comes is that it is often oversold and underdelivered. Effectively, we've established a certain number of genetic markers. Think about those as road signs as you are here throughout the whole canine genome. And then with a database, we were able to recognize that certain breeds tend to have these genetic markers. You see where this is going? So when we run a genetic test, we're looking for the genetic markers, and then we basically decide your dog has 50% of the genetic markers associated with the Danish working dog, and 50% with the Swedish working dog. Totally missing that. He's got Clark, this is adorable. But it's effectively that your dog has inherited the genetic marker that we typically associate with a certain breed. It has nothing to do with what your dog actually is. So when your Great Dane, which is a beautiful, gorgeous AKC champion, comes back carrying 25% of the genetic markers that we find in the Chihuahua, that's kind of fun to talk about, but it's meaningless for the dog. That's the thing about breed identification, is at this point in time, its functionality is really kind of not what it should be. There are some that would argue that, well, if your dog has 25% of the genetic markers in the terrier, then we would expect it to have high energy and high prey drive and all of that. And that's making a huge assumption, again, with the cinematic method. That is making a huge assumption that it inherited all of the genetics that cause it to have high energy and a high prey drive, along with the genetic markers that we associated with that breed. It may be true, I don't know. But that's where we're at, and we do not offer breed identification at this time. I can't say that we won't offer it in the future because there's a huge commercial opportunity, and the science is getting better every year. The databases are getting more, and we're understanding what these genetic markers do and do not mean. Now, this goes back to your comment about the seed. And this comes back to what tests we include in our panel, but also what tests are included in check. And it is a circular discussion. Breed clubs are concerned about what diseases are within their breeds. They talk to commercial testing companies. Commercial testing companies talk to academic research, and everybody talks to everybody. What Chick has done is they try to filter all of these communications that are happening between the three institutions to develop the Chick program. I would hope that they evaluate what they include in their Chick certification for each breed. I don't know because I'm not a part of that, but I know that's where it comes from, which also explains why we offer more tests in our essential panel than are required by Chick for everything that I just said. And at the same time, sometimes something should be included that isn't. And so it is a constant evolution of information between the different organizations. All right. We're going to move off of the commercial aspect of testing, although I'll be happy to answer questions when we're done. And now let's talk about polygenetics. So the two things that I picked out to talk about this is the things that are pretty easy to see. One is pretty easy to see, and the two is hip dysplasia affects almost every dog on the planet. So I will say this before I get into it. This is not my comfort zone. This is stuff that I've been processing and learning about. so I don't have all the answers when it comes to this, and in fact, when you see more about this, you'll understand it's gonna be a long time before we do fully comprehend this. But I wanted to share this because this is truly interesting when we start talking about genetics. All right, we know that small dogs are making up more and more of the dog population as a whole. And there is a common or an understood hypothesis that we are breeding for size, that small dogs are becoming more popular, and as such, we are breeding dogs to kind of fit better within most people's lives. So that kind of creates the relevancy for why we're going to talk about the genetics of small dogs. All right, so
Comment about this one. You use the greater sign.
did I get that wrong?
Yeah. That's a greater sign,
Oh,
greater than
right.
30 pounds.
Thank you, we'll make that change. We're going to talk about morphometrics, which is basically the study of size and shape. Anything that has to do with the musculoskeletal system, okay, is going to be considered polygenetic, meaning multiple genes are responsible for producing the phenotype that we result. That's the point of this discussion. All right, now, we are aware of 20 different genes that affect size. Does that mean it's limited to 20? No, that just means what we are aware of. Now, I want to talk about one in specific. Before I get into that, I just want us all work up the same page. Dogs have 39 pairs of chromosomes. And I'm bringing this slide up here because we're going to talk about the location of the genes that we're discussing and where they are within the genome or what chromosome that they are located on. All right, because they have 39, that does not make them genetically superior to us humans. Does anybody know how many chromosomes humans have? 23. That's where we get things like 23andMe. Humans have 23 pairs of chromosomes. Dogs have 39. Does that make them genetically superior? Not necessarily. This is a fully whippet. It has a mutation in the MST gene causing a condition called myostatin deficiency.
That's not a fixed photo, that's real.
Yeah, that's real. That's a genetic mutation right there. I love that dog. That's the Incredible Hulk of dogs. Yeah, that is a true. That is a real condition that presents and that produces the fully whippet. Yes. Okay, but I use it just to show like that dog, but that does not mean that they're genetically superior. This is going to come back to the kind of the sense. One of the points I'm trying to make is that we understand that there are whole swaths of the genome which are what we used to call non-functional. Sometimes we use the phrase as junk DNA. As we go back and we learn more, we're realizing that when we say non-functional, it means they don't code for a protein that we recognize. That doesn't mean that they're useless. It just means that we either don't know their function, but now we're finding out that these non-coding regions do actually have an effect, or some of them do, in terms of they basically regulate gene expression, which is becoming a very significant direction in which we're going into science. All right, and the one I wanted to talk about when it comes to science is this gene called the IGF-1 gene, or the insulin-like growth factor. We know that the gene regulates the production of insulin growth factor, all right, which is a measurable hormone. This hormone is produced in the liver, and it in turn regulates other growth hormones. So it's kind of like basically the snowball as it rolls down the hill. It kind of sets things in motion to create a number of different physiologic pathways which will affect the size of the dog. And the cool thing about IGF-1 is that we, at this point in time, we believe that it is responsible for over 15% of the dog's size is caused by its level of IGF-1. Now keep that in mind, that's 15%, right? That means that 85% of the reason why one dog is this big and one dog is this big is coming from other genes altogether. Now, in contrast to humans, we know that height and size is controlled by thousands of genes. Humans have the benefit of being much more intensely studied for a longer period of time. Now, we say that IGF-1 controls about 15% in the dog. Its nearest neighbor in the human controls less than 0.5%. And did I get it right this time? Okay. All right. I was like, you made me double check. I was like, okay, yes, you're right. I got it there. It's less than 0.5%. So it just kind of shows you that with dogs, it's like, wow, there may be a playing field in which we finally really do understand something significant. Now, the IGF-1 hormone, this is something we can actually measure. We can take a blood sample and we can send it off to the lab and see where's your dog's IGF-1. And it becomes a diagnostic in terms of if your dog is having significant, it becomes an evaluator of liver function, if we suspect dwarfism is the case. Now, there are a number of mutations which can present in a dwarf dog, but this is something that we can measure to understand why your dog is a dwarf. It also can be an indicator of nutritional status. Okay, so it does have some diagnostic function. Now, the thing is that we clearly recognize that toy breeds have significantly less of this IGF-1 hormone than non-toy breeds. All right, but the thing is that we couldn't quite nail down why there was a certain inconsistency is why some dogs would seem to have plenty of IGF-1, but they would be small, and the converse would also be true. Until recently, during the pandemic, a PhD student kind of went back and kind of dived into what they all knew about the IGF-1 factor, and what they really what they discovered was that there was a mutation within the non-coding region of the DNA, back in that junk DNA that I talked about before, that determined to regulate the expression of IGF-1 gene. Right? So in other words, they were able to look at that junk DNA and realize something turns on the production of IGF-1 and something shuts it off into, and this, as I'll show you, this is something that has been within the dog's DNA. It's not something new that was bred in. It was like, this is what determines why this gene will express the hormone or not. So they went back and they looked at DNA samples from dogs. I read about how they got some of these prehistoric samples, but they went back as far as they can to see if this mutation is something that was recently, in kind of the last 100 to 200 years. Is this something that we just bred in as we try to get smaller dogs? And what they found out was this IGF-1 mutation is an ancient mutation, basically as dogs evolved tens of thousands of years ago. Now, interestingly enough, the IGF-1 mutation is recessive. And so kind of think back when dinosaurs ruled the earth, mammals were very, very small. And so they were all homozygous for this mutation. But there is a strong selective pressure for bigger size. And so as mammals started to dominate more on the planet, bigger animals did better. So when we're talking about the whole evolutionary tree of the canid, bigger canids were doing better when it came to surviving in the wild. So there was this evolutionary pressure to move away from the IGF-1 mutation, which kept things small. Now, the mutation was conserved within the population within heterozygous animals. So, in other words, that not, because the dominant gene was the larger gene, was running around there, the smaller gene was still present. All right. Now, when we domesticated, or the dogs decided to let us domesticate them, that's where we started to select for a smaller, more functional dog. Whether that was for guarding, herding, ratting, or any of the other general purposes by which we domesticated the dog, we found that the smaller dog just kind of worked better with us. And so we again started to select for the smaller dog, which allowed the re-expression of the recessive gene which controlled the insulin growth factor. All right, that was kind of fun and cool, but how does that affect you? And this is what we're going to talk about with the polygenetic. We know that we know of over 20 different genes which control size, of which the IGF-1 gene is only responsible for about 15%. All right. Now, there are other things that are also responsible for the genetic size, or for the size determination of your dog, of which nutrition and environment also plays a role. All right. So when we start dealing with offering a genetic test for a polygenetic trait, it comes down to the question of how you're going to interpret that information, and then what are you going to do with it. Because the problem is that because that IGF-1 gene, which we can test and discover, only controls about 15% of your dog, what is going to be the usefulness of that? You could get a dog that's homozygous for that variant and say, okay, great, I've got small dogs. I think I'll be normal size. Because whatever is controlling the actual size of your dogs may be coming from that other 85%, or the other 20, or the other 19 different mutations that we understand the control size. Or you're feeding the best diet on the planet because you want them all to go estrus, but that is also going to promote a nice healthy growth size. So there's these number of confounding variables. So it's very, very, very hard to reduce a polygenetic trait like size to something as simple as, well, we know the IGF-1 test will control somewhat of body size. So how much value does that have for a breeder? All right, now that I've kind of introduced you to polygenetics, let's talk about something that really is specific to almost every bred dog, and that's canine hip dysplasia. All right, was first described in 1935, and we have been studying it ever since. All right, OFA, I think I have a slide on this, I won't get there. It is considered to be one of the most prevalent of all inherited conditions, with something like, and I don't quote me on all my statistics, but 50%, 56% of all dogs will experience hip dysplasia on some level throughout the course of their life. We know that it's heritable because it seems to have breed predispositions, Labradors being something that comes to mind quickly, but there are certain dogs that seem to experience hip dysplasia consistently and more regularly than others. But because it's musculoskeletal, we have to assume that it's polygenetic. We also know that there's an environmental component. And so you take that whole thing together and we're looking at a very complicated problem. OFA was founded in 1966, and a part of its initial mission was to provide radiographic evaluation, data management, and genetic counseling for hip dysplasia. And we think that if it was a straightforward problem, I mean, we've worked on that for, what is it now, almost 80 years? And, have we made a big significant dent in the prevalence of hip dysplasia? Not so much. And that's because it is coming from a lot of different etiologies. But, the nice thing, I do give a lot of respect for OFA because as a repository, and starting with this one problem, they've become a repository for data for all sorts of problems. Personal feelings aside, they're trying to improve dogs overall. All right, so this goes back to like retesting for size. The challenges to a genetic test is that we've identified some genetic markers that are breed specific, meaning that if your Labrador has this one gene, that means that it's at higher risk for hip dysplasia, versus genetic markers that are universal across all dogs. And so when it comes to offering a genetic test, is your dog that's not a Labrador but carries the Labrador gene, what is its true risk for getting hip dysplasia? That's where it creates that problem or that breakdown. We also know that hip dysplasia happens from numerous etiologies, these of which are 3. We know that abnormal alignment can lead to hip dysplasia. We know that abnormal cartilage can lead to hip dysplasia, and we know that abnormal ligaments, the ligament of the femoral head, or laxity within the hips, can also cause hip dysplasia. Now you can only imagine that even just knowing those 3 etiologies, the genetics for these behind these etiologies is huge. All right, then on top of all that, we have expression and regulation. This comes back to why we talked about the insulin growth factor. One is the presence of the factor, and the other is how much does that gene produce, or how much protein does that gene produce. So we see that when it comes to any of these etiologies. I didn't got to make thematic. All right. One thing I wanted to share with you is a paper was produced or published in 2021 out of the laboratory in Finland, which does a lot of canine genomics. Every time I read their papers and stuff, I'm like, God, if I could go back in time and do a PhD, I would do it that way. They do a lot of good information. And unfortunately, they have a strong partnership with Mars, and so they are part of the reason why the Wisdom Panel is able to produce certain tests before the rest of us. So that's a good thing for them. They are very fortunate to have that resource. But in this study, it was landmark in the sense that it was trying to be comprehensive. First is that they used 1,600 dogs across 10 different breeds in their study, which made it very, very much more robust than any study had been done previously. The next is they looked at all of the markers that we had at that point in time associated with hip dysplasia. And I think they looked at 54 and they were able to validate 46 of them. All right, when we say polygenetic, that is by definition right there. The fact that they looked at 46 different genetic pathways to produce one disease. Now, with their study, looking at the large number of dogs they took that 46 and they were able to validate 21 different genes. When I say about validate, it means that, so when you publish something and you say, yes, this is a truth as we understand it, then she should be able to come along and do the same study I did and get the exact same results if my study was valid, right? That's effectively what they did, is they went back and they looked at all the publications and they said, do we see a repeatable result in all of these genetic markers, and for 21, they were able to get that association. And those 21 different loci were associated on 14 different chromosomes. 20 of these were associated with canine hip dysplasia in specific breeds, where one was unique across all breeds included in the study. They further characterized the association of loci that could reveal canine hip dysplasia relevant genes and pathways for improved understanding of the disease of pathogenesis, or how canine hip dysplasia works. It's just hard. Now, one thing that I looked back and as I was reading this paper, I thought that's great, and I'm trying to think of the challenges that we tried to try incorporate a genetic test that looked at 21 different markers. And I don't think we'd be able to produce anything that would be really useful for the dog breeder. But I was reading through the paper, and some of the specific genes that they looked at had some really interesting points. And one is that they found that the NOX3 gene was significant finding for German Shepherd dogs, which we know German Shepherds are classic for hip dysplasia. Now, the interesting thing is we know the NOX3 gene
I think that's